And again, welcome everyone to our webinar, which is Caring for Someone with Macular Disease. And this webinar will be run in the form of an interview. So we'll be interviewing carers Susan Fallon and Leonie Walton. My name is Natasha, and I'm in the education team at Macular Disease Foundation Australia, and I'll be hosting today's webinar. So before we formally introduce our guests, I want to start by defining who is considered a carer. In most cases, a carer is usually an unpaid family member or friend. So this may be a daughter providing care for her mother. It could be a neighbour checking in on the person next door and helping them to read the mail. Or it could be a friend stopping in each week to drop off groceries. So the reason it's actually important to identify who a carer is that the experiences shared today are for those in an unpaid caring role, such as the examples that I mentioned, and they do not apply to professional or paid care workers. Another important aforemention is when caring for someone with a macular disease, it is important to understand what macular disease is. Macular disease is an umbrella term for a range of different eye conditions that affect the part of the eye called the macula. The most common macular disease in Australia is age-related macular degeneration, but of course there are other eye conditions that affect this part of the eye. What is common to all macular diseases is that central vision is affected, and common issues include difficulty reading the newspaper, problems with recognising faces or picking up on facial expressions, sensitivity to glare, and also sometimes colour vision changes. And the reason I mention all of this is because it is important that if you are caring for someone, it is important to have an understanding of this person's diagnosis and what it means to have a macular disease, so you can better expect what kind of support they may require. Okay, so now I would like to welcome our guests today, Susan and Leonie. So I'll start with Leonie, who's shown here on the left. So Susan is a carer for her mother, who lives with late-stage wet age-related macular degeneration in both eyes. Her mother, Helen, was diagnosed about 7 years ago. By the time Helen saw a specialist, her AMD was quite advanced. Helen is now legally blind, but can live independently with the support of community services that her daughter has put in place for her under the Commonwealth Home Support Program. Helen enjoys spending time attending to her pot plants on her balcony, listening to the radio and spending time with her adult grandchildren. Susan wants to share her experience with other carers so that they feel better equipped in knowing what to expect and what support is available. Our other guest for today is Leonie, who's shown here on the right. So Leonie is the primary carer for her mum, Rita. So Rita is 89 years of age and has lived with dry age-related macular degeneration for 17 years. Rita is legally blind, but is a feisty, active woman who lives by herself in her family home with a one-eyed Pomeranian dog named Rufus. Rita's husband, Jim, passed away when they were in their early 60s, so she has been both mother and father to 7 children and 14 grandchildren. She remains physically active with walking and swimming and is considered the great old dame of her street and her suburb, where she's lived for the past 70 years. Rita's mother lost her vision to AMD, and Rita herself is one of 8 children, three of whom who have lost their vision to AMD as well. So welcome, Susan and Leonie.
Hi, everyone.
Hi, Susan. Hi, Natasha. Thanks, everyone.
All right, so we'll start off with the first question. So I'll address this one to you, Susan. So as a warm-up, how long have you been a carer for your mum, and how did you come to be her carer?
I've been a carer pretty much since the start of my mother's diagnosis of AMD, which was approximately about 7 years ago. She very unfortunately left it quite late to see a specialist, so her loss of sight was quite advanced by the time she went. So since then, I've primarily been the primary carer with assistance from other members of the family. And I suppose I'm the primary carer mainly because of distance. So I live a lot closer to her than other family members. So it really happened quite by default.
Mm. And how about you, Leonie?
So similar kind of situation. Rita, my mum, has the dry form of age-related macular degeneration, and she was diagnosed when she was 75. And I actually remember the night it happened. She was driving back from the city over the Anzac Bridge in the evening, and quite literally by the time she arrived home, she was absolutely petrified because she couldn't see a thing driving in the dark. So it was off to the specialist, off to the optometrist, and then to the ophthalmologist to get the diagnosis. In terms of how I've stepped into the role of carer, I'm the youngest of 7 children, and being I suppose the youngest, and also still living in the same suburb as our family home, and not having children, that sort of I was the one who received the task of taking care of mum.
All right, and so for the next question, so Susan, we'll start with you. So that your mum needs help with, and also how have these needs changed over time, from when you first started as her carer?
Well, in the beginning, she didn't need a lot of help. She was managing quite independently, but as obviously the disease has progressed, more assistance has been required. It can vary from anything from, just checking in on her regularly, sometimes daily, sometimes twice daily, helping read things, pay bills, read bills, a lot of the finances, assisting with transport, with doctor's appointments, with medication. The list can go on and on as the disease progresses, even down to coordinating care support services for her. And it's little things such as putting little tactile markers on things. So I'm going around her apartment where she lives and adding those things so she can feel what's on, what's off, and light switches and those sort of things. So the activities have really changed. That didn't all obviously start from day one, but as the disease has progressed, then so has been the level of care.
Yeah, and do you find it was your mum coming to you saying that she was finding difficulties with these activities, or was it also you identifying that she wasn't doing things as well as she used to?
Not necessarily. Like my mother's Helen's a very stoic kind of woman. I suppose it comes from her German background. She wasn't going to ask for a lot of help. So really it came from my own observation. And then once we started a few things, and that certainly helped along the way.
Great. And how about you, Leonie?
Yeah, again, really similar situation. Stoicism just seems to be part and parcel with this generation that we care for. In terms of the key activities for mum, like Susan and Helen, at the beginning of the disease, there was far more sort of movement and capability, just in terms of, being able to get to the shops. Driving obviously dissipated quite quickly, as did reading, but being able to go to the stores, I mean, shopping is quite a big thing. I mean, it's a sort of daily activity, and after a long time of caring, it becomes a little bit of a drudgery as well, I must admit. But in terms of the progression of activities, I think it's also in line with the person getting older as well. So it's not just the disease, but they're also aging. So they're sort of hand in hand in terms of how you assist, or how I assist.
Yeah, and how about, I guess now with COVID, Leonie, do you find that that's impacted some of the activities that your mum's needed help with?
Absolutely, absolutely. Because there has been a need for our loved ones and older Australians to actually be in a far more safer environment, it means that the role as a carer, and what I've found is that things that were allowing allowing them to be far more independent, like going to the shop, like doing their own shopping, has actually been taken away from them. And that's purely because of the risk of the coronavirus. So even down to Mum and I are active swimmers. So with swimming pools actually closing down, they're reopening at the moment, but I only took Mum for the first swim over the weekend. And that's because we're in a position where it's sort of safe enough for her to be able to go out and be in a far more public setting. So for Mum, it's, you know, she's still not actively going to the shops. She had a short period of time where she could go back to church, but that's no longer available to her as well. So we've sort of had to go back into lockdown just as the numbers of the virus change. So it has added an extra element to the caring role, definitely.
Definitely, yeah.
I think for my mother, I mean, we're doing a lot of telehealth phone calls nowadays, and just to try and explain to somebody about the technology and how we're going to talk to this doctor has been a real challenge. So it's not only been a situation of trying to keep them safe and healthy and the mental strain it has because of the isolation, but also trying to deal with the things we normally do from a day-to-day business. So COVID has certainly made things a lot more difficult.
Yeah, and Susan, is your mum still receiving treatment for her wet macular degeneration?
Yes, she is. She receives it once every 3 months, and religiously we go.
Yeah, and that hasn't been affected at all with anything with COVID-19?
No, we obviously take a few extra precautions. Obviously, wear a face mask, hand sanitizing. I usually take her to the appointment. We make sure that we're socially distanced, so we minimise the risk as much as we possibly can.
Great. Yeah, so I guess it's really important to be flexible. So not only with changing circumstances like COVID, but also from what both of you have said, you know, as the vision progresses, there are different needs that come up over time, and it is important for not only the person to identify, I guess, what activities they need help with, but also for the carer to kind of step in where need be and maybe suggest, you know, assistance here and there. All right, so moving on. So we've kind of spoken about some of the basic needs like transport, assistance with shopping, but how about maintaining hobbies? So Leonie, I think you did mention that you and your mum go swimming, and also your mum goes to church. So
Yeah.
how have you found, you know, maintaining hobbies through vision changes?
Well, so I mean, again, this brings the COVID conversation into play as well. So pre-COVID, obviously greater access to some of those facilities that actually allow access into the community, a focus on health and well-being. So being able to go to the swimming pool, she goes and swims in the hydrotherapy pool and does her laps, you know. So last summer she was swimming anywhere between six laps and 10 laps. Over the weekend, we went back for the first time, and quite literally it was just some muscle exercises in the hydrotherapy pool. So normally in a pre-COVID existence as well, we love to go to the theatre together. We go to the symphony. We'll go to concerts. But obviously in a post-COVID environment, that's not available to us. So we've like everyone in this environment, we've really had to adapt. So the exercise regime, which is fundamentally really important to someone's physical and mental well-being, has had to change. So it's far more just sort of walks in the park with Rufus, the one-eyed Pomeranian. Very important to take him out and keep him active as well. But things like, even over the weekend, Mum didn't have Netflix on prior to the COVID situation, but we've actually got her up and online. So she's you know, got all these new streaming technologies. So things like, you know, even watching the Pavarotti documentaries and listening to the different theatres that are actually available and being streamed. This is where she's been able to still participate and do those things that she really, really enjoys, but in a really safe environment. We're hoping that we can go back into a sort of normalised situation where we're actively going out and really embracing life in a very communal way. But at this very point in time, it's really a case of just coping with and working within the means of what we've got at the moment, but also still allowing her to enjoy the things that she enjoys, because there have been restrictions even to the point where the grandchildren aren't really necessarily in a position to be able to come over and visit as much as they would. And when they do come over, and particularly in the heights of the COVID virus, they were actually standing out on the balcony and talking through the door. So there's still trying to maintain that connectivity with family and friends and neighbours and the community, but it's doing it in a really safe environment.
That's great. Yeah, that's really important. I think particularly now that people, may be living by themselves, it is really important to reconnect, with family and friends. But also, there's been lots of people who have, picked up technologies that they may not have used before. So whether that's, Netflix, a lot of people using Zoom and Skype now to reconnect with people they can't meet face to face. So it's definitely been a good push, I guess, these lockdowns for people to pick up those technologies.
Absolutely.
Susan?
Well, sadly, because of my mum's loss of eyesight, her hobbies have diminished somewhat. She used to enjoy sewing and cooking and baking and those sorts of things. It's very difficult when you're legally blind. So what we've actually had to try and do is try and replace those hobbies with something else. So we discovered she loves music, so listening to the radio, listening to CDs is quite helpful for her. Even just listening to the TV. So it's a matter of trying to replace those hobbies with something else. And as Leonie touched on, the isolation that COVID has brought is a big thing as well. So you almost, as a carer, have to be a gatekeeper as to who's coming in and out of the home, to make sure that they're safe, they're healthy, and everything's okay.
And there's been a real focus on the role of the carer to maintain our own health as well. So, like you, Susan, I might be in the office today, but I'm incredibly vigilant about where I go and what I do, and maintaining my own health so that I minimise any kind of risk of any kind of infection, not just a coronavirus, but any kind of illness coming into mum's house too.
Fabulous. Thanks both. Now move on to this question. So just based on what we're talking about in terms of, finding assistance for some of those key activities they need help with, but also, to reaching out to community services to help maintain hobbies. What key services, we'll start with you, Susan, have you reached out to provide this help?
There's a multiple of services out there that you can tap into. My mum Helen actually receives quite a lot of services under the Commonwealth Home Support Program. She doesn't receive a package, and probably the downside of that is that I'm the coordinator of all of those services. But some of the services she does tap into, she obviously community transport she uses, domestic assistance she uses, podiatry she uses, assisted shopping she uses, and more recently some community nursing to help with her medications. She's having somebody come every day to help her with those. So there are loads of services out there. It involves having an assessment done, unfortunately, which a lot of people don't like to have, but it's necessary to be able to access those services. So even things like having the GP is a good service, because if there's something you don't know what to do or how to do it or what you can access, talking to them can quite often open doors as well. So there's lots of things out there. You just have to be proactive and look for them, ask for them. The foundation is great in tapping you into services that you may not know about.
Yeah, and I'll just expand on what you mentioned there when you spoke about the Commonwealth Home Support Program, Susan. So I'm assuming that's through My Aged Care that you organise those services?
Yes, it is. Yes.
Yes. Yeah. And so can you talk just for,
just understanding that in itself is a big issue. I mean, the whole aged care system is quite a complex thing to get your head around. Obviously, you start off with My Aged Care and you start off with the assessment, and then depending on what your needs are, it goes from there. Sadly, a lot of people have to end up waiting for packages. So whilst you're waiting for a package, the only option is to use the Commonwealth Home Support Services. And they're quite good, but the downside of it is that you have to be the active organiser of those services. So there's a down, you know, there's advantages, disadvantages to both.
I must admit, Susan was a great support to me because Rita, the only thing we basically had organised for dear old mum, maybe I'm not the best carer, was a cleaner to come in every fortnight. So I actually leaned on Susan for some information, some intel, just in terms of how to actually organise, and also some of the staff from Macular Disease Foundation, how to organise that next level of going through the My Aged Care system. So it was really good to get that information to be able to guide me through and ask the right questions to be able to make assessments in terms of just future-proofing mum. Not that she requires it at the moment, but just to make sure that it's in the system so that when she does in fact need it, that we can call upon it, and the paperwork, the administrative work is actually already there. So we actually did this through COVID. So the first occupational therapy assessment was done over Zoom, which was a really interesting process, having to sort of walk around the house with a laptop and take photographs and send them over, and have them come back with assessments on furniture fit outs and trips and hazards and how to avoid a lot of these things. So it was really good to be able to lean on someone who had done it before and get that advice. And it was also a really interesting process doing it without a physical person coming into the house to do the assessment. So I actually got a hands-on experience of what that OT assessment was actually about. So it was interesting.
Great. And are there any other community services you've leaned on, Leonie, to help your mum, you know, with any hobbies or any of those basic needs?
Yeah, we do a lot of the community stuff. So the local library, mum is an avid reader / book listener. And so we now get a delivery every 2 weeks. So she'll go through 20 reading books a week, which is just crazy. So that's something that's really good. A lot of, in terms of leaning on, so the local council have a lot of opportunities to be able to engage with the older Australians, whether they have a health issue or not. That's a great form of support, and just again engagement with the community. I think it's a really good thing.
Definitely. All right, moving on to the next one. There we are. Okay, so we did speak very briefly about this. You're both saying your mothers are very stoic, and there was maybe a bit of pushback to some of those services or assistance with some of those activities they need help with. But Leonie, how did your mum first react, you know, in you stepping in or in, you know, assistance just around the home in general?
Not well, Natasha. Not well at all. Actually, I mean, she's the kind of person that will just, you know, you try any kind of change and it's a kicking and screaming situation. That being said, once she gets comfortable with the situation, then she's more than accepting to sort of receive assistance. Mum, I think, because she is of that stoic breed, she doesn't actually believe she has a side issue, even though she's legally blind. She's just, it's not avoidance. It's not denial. It's just avoidance. So yeah, change is a slow, Titanic moving situation. That's all there is to it. So, and what I've found with Mum is that you can't rush her into things. You can't push her into things. And I suppose part of that is the having to take on new activities, or not so much learn new things, because she's really open to learning new things. She doesn't like to be mothered by a child, that's for sure. That's one thing. But I suppose it's that independence that the more you bring into her life, I suppose the more independence she's giving up, which is one of the things that she holds on to really, really guards really steadfastly. So it's not been easy, but it's we do it a bite at a time.
Yeah, I quite agree.
Susan. Yeah,
I quite agree. I can resonate with all of that. I mean, for me, it was, or for my family, it was a very, very challenging time. I think the biggest concern from my mother's point of view was she didn't want strangers coming into the home. And you can understand with somebody that's got macular disease, quite often they can't distinguish between faces. And when you get these services coming in, they're quite often different people every time. So the thought of having strangers in the house was a big obstacle for us to get across. But very much like Rita, once the services did start, and we started it in dribs and drabs, and a bit of adjustment along the way, she slowly became comfortable with that. That doesn't mean still to this day she doesn't have a whinge about it. She'd love as much as possible to have her independence back, but she's at a stage now where she does need a lot of care and assistance, and she's resigned that this is the way it has to be. So yeah, it's just a matter of being patient, being trying to explain it, and hopefully it'll, fingers crossed, all goes well.
Yeah, and if it doesn't work, what we've found is if it's not working for them, just stop it, reroute, turn it around, try something different, because I think there's no point trying to torture the situation if it's not convenient for them. Maybe convenient for the carer and for the family, but if it's not working for the person who's on the receiving end, then you just have to sort of bite the bullet and try a different tact.
Great. And now with this next question, so we're thinking of yourselves then as the carer. So what did you do to care or support yourself, Leonie?
Other than gin? No. Well, respite is a really big important thing, and it took me a long time to actually allow myself that opportunity to take some time off and to regroup. For a long time, I sort of burdened myself, probably unnecessarily, with the fact that no one else could do the same job that I was doing. I still argue that with my family as well, that Mum doesn't get the same level of care that I give her when I go away and have a holiday. But it's a really, really important thing to do for your own physical health, for your own mental health. And it actually took, I did a walk across the north of Spain, and it was, a sort of pilgrimage walk where, you walk for 600 kilometres and you come out at the other end, and all the weight of the world is lifted off your shoulder. It was exactly the opposite for me. I started the walk and I got angrier and angrier with every foot and every kilometre. And by the end of it, I realised that the anger I had was actually resentment towards my family, and I had to change that. So if they're watching today, I love you all, but you know, it was a really important thing. So I actually had to come back and take control of the work that I was doing for mum, but also allow other people into the mix, and not just family, but also friends and neighbours, and that village. I mean, it takes a village to take care of an old person as well, not just a child. So I'm less of a martyr about it all now, and I definitely give myself the time to be able to go off and have my own life, to do what I need to do. And I have no qualms in asking other people to step up, because it's just not a one-person job at all.
Just following on from that, it's just so important just to ask for help. If you're in a fortunate situation where you do have a family that can support you as well in that role, that's great. But if you can't, then just having, you know, even if it's a day away doing something that you want to do, whether it's going to the movies, something where you can switch off without having to think about your carer responsibilities. Because at the end of the day, you don't want it to become, that's not the only reason why you're here on this earth, is to be a carer. You have other responsibilities and other duties that you've got to do. So I think it's very important to have a break from it, so you realise that there are other things out there as well.
And not to build up resentment for the person that you're actually caring for, because that's not the situation you want to be in, and it's not fair to them, and it's not fair to yourself as well.
Yeah.
Mm-hmm. Yeah, I imagine it will be a bit of a shift in dynamic, you know, being a mother-daughter and then now you caring for your mother. Yeah, so it is really important, I guess, to look out for yourselves, and also use a lot of those community services that you both spoke about, because there are a whole range out there. So we'll talk on those very shortly, but definitely, you know, through My Aged Care and the local council, a lot of services that are available to support you. Moving on. So we'll start with Susan for this one. So what were some of the biggest challenges you faced being a carer for your mum?
I think it's been probably the never-ending list of things to do. You seem to just fix one problem or address one issue, and no sooner do you finish that than you go on to the next. So it's been quite a challenge to get through that list, to stay on top of that list. And obviously, as the disease progresses, then the challenges can become even greater. Probably one of the biggest challenge for me was the complexity of the aged care system. That by far blew my mind away, trying to get my head around all that, but seemed to have got there with patience and time. And probably the third thing would be just to try and spend quality time with the person that you're caring for. As I said, and I touched on it before, quite often you spend a lot of time worrying about what the next thing is, what's the next thing to do on the to-do list, but you never actually sit down and have quality time with the person you're caring for, and in this case with my mum, and just having a conversation where we don't have to talk about any of that. That's been a challenge from time to time, because, you know, conversation tends to just go into that direction. So it's just nice to have an outing or a function or do something with them that has nothing to do with caring for them.
And how about you, Leonie?
Yeah, I agree. I think the biggest challenge is, for me, has just been juggling priorities. I mean, when everyone is a number one priority, so when you have someone you're caring for, family, career, yourself, your own life, these are all competing priorities. So it's really a case of just balancing all of that, to make sure that everyone, including yourself, is sort of getting an equal footing. That's the biggest challenge. There's just sometimes just never enough hours in the day to be able to do everything that you need to do. So it's a case of just, you know, getting a really good checklist together and just working through it step by step. I find, you know, it's the juggling that's the biggest challenge, I think.
And what have you found helps, you know, to juggle all of those tasks or responsibilities?
Well, I've been doing it for a long time now. So I actually, time has actually been, time will help. It actually allows you to, so what used to overwhelm me no longer overwhelms me. Being able to ask for that additional assistance from, you know, family or friends or neighbours or whomever, from the providers that are actually there. I think outsource where you can and when it is possible. So shopping used to be fine, grocery shopping used to be fine, and then over the years it has turned into a form of extreme torture for me, shopping with mum. So that's now one of the things that, as much as I possibly can, I put someone else in charge of that. Or, I mean, you know, in COVID, it's not even on the cards. I just go in and do it. But Susan, I know that shopping's been a bane of your existence as well. So what turns into, you know, fundamentally what should be a half-hour task on your weekend after a really busy working week, with someone who lives with macular disease, can turn into 2.5 hours of just torture because they want to read every single little price tag and see every single product that's available. So, you know, I think where you can outsource, just get rid of it.
Right. And now you did mention, you know, shopping may take a bit longer because with AMD or age-related macular degeneration, you know, reading is affected. I think one of you mentioned before, or Susan, you mentioned that your mum has trouble sometimes with facial recognition. So these are all common symptoms that can come up for other people living with macular diseases. So starting with Leonie, so is this something you've learnt about AMD, you know, through caring for your mum that you would like others to also know?
Well, I think the biggest thing for everyone to take away, when mum was diagnosed with AMD, we had never looked at the family tree. So even though my grandmother had died with low vision, she also died with diabetes. So we're not quite sure whether it was a diabetic eye disease or whether it was an AMD and she had diabetes. And then mum being one of 8 children, there's 3 that have been diagnosed with AMD. I'm one of 7 children, and I have an older sister who now has the early stages of drusen in the eye, so very early stages of AMD. So I think one of the biggest learnings outside of the symptoms and living with the condition is the simple fact that within your family there is a risk, there is an inherent risk. So it's really important that, and none of us knew it. Even when mum, I think it took, you know, years after mum was diagnosed before we started actually having a family conversation about it. So I think that's one of the big takeaways, that if you're caring for someone, you know, a parent or, you know, a sibling with AMD, that you need to be just as rigorous in terms of checking your own eye health and maintaining a really healthy lifestyle to maintain some healthy eyes as well. So.
Yeah, I agree with Leonie. Diet and all the other risk factors so much come into play, and it's really important that we recognise that there is a hereditary element to it. So, but one of the other things I think is that I'd like people to take away is that, like, knowledge is power. So to learn as much as you can about the disease, because then that helps you preempt things. It helps you understand. It helps to hopefully avoid some of the frustrations that might occur. And another thing I would probably want people to take away is that to get support in place takes a long time. It just doesn't happen overnight. So you've really got to think ahead, and just don't think about here and now what they need now, but think in advance what they might need in 6 months' time, 12 months' time, and try and plan a bit for the future.
Great advice. Now this touches on very nicely into this next question. So might continue with you, Susan. So what did you wish you knew before you started out as a carer?
Wow. What do I think I wish I knew? I think, like, I'm going back to my mum's situation, and when I look back, I think of little things that were going wrong and I didn't identify them. I remember once she made me a cup of coffee and she put salt in it instead of sugar. So she was having difficulty some time ago before she actually received her diagnosis. So I suppose what I wish I knew, I wish, like, she had this misconception too that her loss of sight was because of cataracts. And I think a lot of people think, oh, my poor sight is because of cataracts, and didn't have it tested. So what I wish I knew was that I wish I would have, expressed that at the time, had it checked by a specialist and by an optometrist and an ophthalmologist, and had that assessed well in advance to when it actually happened. The other thing is, I think I underestimated about how much time it would all consume. But that's just the way it is. So
yeah, everyone's had the salt in the cup of tea story. We've had very salty cakes over the years, and my word of advice is don't touch mum's chicken because it's never necessarily cooked through that well. Always double check the chicken. I think just in terms of what I wish I knew before I started out as a carer was firstly to ask for help, and that didn't kick in for a really, really, really long time, and that led to, I suppose, unnecessary burden and martyrdom, which leads to resentment. So it takes time to actually pull that back and get it all balanced out again. So I wish I knew in the beginning that, again, this is not a solo journey. It's really got to be the village that takes care of the person. So I think that's my biggest learning from all of it, and it's a good one to learn, and it's easier to learn it at the beginning than it is towards the end.
That's great advice, thank you. And now this is actually our last question. So Leonie, what has been the most rewarding part of being a carer?
The most rewarding part, well, apart from I suppose apart from the ability to be able to give back to someone who has cared for you, is it's a real privilege. Parents bring you into this world, and if you can take them out with grace, then that's a real privilege. But I think the other thing that I love about caring is the carer's card, because it's really cheap to get into the swimming pool when I swim with mum. We get discount tickets to the theatre, which is excellent. I often don't have to pay. And I've decided that the best thing about travelling with mum, because we do lots of overseas trips because she loves to travel as well, is that disability, if you apply for a disability travel, it's better than business class. You're on the plane first, you're off the plane first, you get fed first, everything's first. It's really, really good, and you never have to actually lift a bag, and you get wheelchaired and on the dolly trolleys absolutely everywhere. So I think travelling with mum is really, really good fun. And in the Louvre last year, when we went and saw the Mona Lisa, we were escorted right to the very, very front, in front of all of the queues, and we got backdoor access at Versailles. It was fantastic. So that for me is like the upside of caring.
The cherry on top. How about you, Susan?
Look, I think the cherry on top for me is when my mum says to me, oh, just doing this one little thing has made the world of difference. So, you know, it could be something so small, like I mentioned before, those little tactile markers that I've put on things, and just it's given her far more independence. So, I mean, for her age and for her that she's legally blind, she really misses her independence, and the more you can give back to them, the happier they are. So when she says that little thing that I did that, you know, took me hours and hours to do or to work out or to resolve has made an improvement on her day-to-day living, that's when I really feel good.
That's great. All right. Well, thank you both so much for sharing your experience. So that was our final question. We are still waiting on some more questions to come in from the audience, but I'll keep you both on the line. So just to go through some of the services that Leonie and Susan may have spoken about, so I know they didn't speak about all of these that are on the screen. I did want to just quickly mention the Carer Gateway. So that's the first number on the screen there. So Carer Gateway is a service for unpaid carers like Susan and Leonie, which supplies free information and resources, phone counselling, skills courses, that emergency respite care that was mentioned, and peer support for people in a caring role. The second service on the screen is NDIS. So NDIS is available for people under the age of 65 who have legal blindness, or for people who are diagnosed with a particular inherited retinal disease. So NDIS can fund community services like transport, meals and cleaning, which were mentioned during this webinar, as well as other supports that can alleviate the tasks that the carer is responsible for. My Aged Care, which was mentioned by Susan, so that through My Aged Care you can access that Commonwealth Home Support Program as well as the Home Care Package. My Aged Care is available for people over the age of 65, and it can fund similar services to the NDIS. So the numbers for all of these are shown on the screen. As well, local community services were mentioned as being an integral part to a lot of the services that Leonie and Susan have set up for their mums. So you can contact your local council for more information about what services are available near you. And actually, Macular Disease Foundation Australia has hosted a whole range of webinars. The first one was hosted with Carers New South Wales, and we also ran another webinar on NDIS and My Aged Care. So if you did want more information about how these services work, we will be sending a follow-up survey after today's webinar, and that survey will include a link to all of these past webinars that you can view.